So the next question in your test was, true statement about the limbus include all except. What is a limbus? Limbus is a structure between where the conjunctiva ends and the cornea starts. What is a limbus? Limbus has palisades of Vogt, palisades, and it has palisades of Vogt and depression, that is the crypts. These two structures are present at the limbus, and the limbus contains the limbus stem cells which are responsible for the regeneration of the corneal epithelium. You all remember these things from the anatomy lecture, okay? So what is a limbus? Limbus is a structure at the scleral corneal junction which is covered by the conjunctiva, and tenons stops 2 mm before reaching the limbus, okay? Only the conjunctiva covers the limbus. It marks a transition between the cornea and the sclera. This is the right option. It is not covered by the Creceives capsule. It is only covered by the conjunctiva. Then the surgical limbus is interior to the anatomical limbus. Okay. The anatomical limbus is what we see here. The surgical limbus is a structure about 1 mm in front of the anatomical limbus from where we enter when we give a limbal incision in cases of cataract surgery or some refractive surgery. Okay, the limbal incisions are given from the surgical limbus, which is about 1 to 1.5 mm in front of the anatomical limbus, that is in the cornea. And also, if we see, if this area is covered by the conjunctiva, naturally we will give an incision in front of the conjunctiva when we are giving the corneal incision, and the limbus, anatomical limbus, extends so posteriorly. Whereas the anatomical limbus extends so posteriorly and includes trabecular meshwork inside. Okay. Was the next question? The vitreous is strongly adhering to. The following structures except. So we have to remember that the vitreous, which is a jelly-like substance in the eye, it is attached to the vitreous base. And what is the vitreous base? Vitreous base is attached to the ora serratum and the pars plana part of the ciliary body. And here the attachment of the vitreous is the strongest. It is also attached to the posterior lens capsule with the help of hyalodocapsular ligament, also known as ligament of Weigert. The next strongest attachment is at the optic disc, where it is known as the Martigianis funnel. These are the 3 strongest attachments of the vitreous. The vitreous is also attached at the macula, but this attachment is weak. At the fovea, that is, but this attachment is weak and is responsible for the vitromacular traction, which can be further linked to the macular hole or something, macular hole or the cystic spaces or the edema, and it is also attached to the retinal vessels. But these both attachments are weak attachments and not the strong attachments as is seen in the vitreous base, hyalodocapsular ligament or the ligament of Weigert, and this that is the optic disc, where it is known as Martigianis funnel. And the vitreous base is attached to the ora serrata and the pars plana part of the ciliary body, where it has the strongest attachment. Okay, what was the next question? The next question was, the optic nerve true is all except. Always see the questions carefully. You have to look at the word except. The optic nerve is made up of just 1.2 million retinal ganglion cell fibers, which give the axons, which are a part of the optic nerve. It receives myelination from the oligodendrocytes. It is clear because this nerve is a central nervous system nerve. So the oligodendrocytes give the myelination to this nerve. It is based by CSF as it is covered by the meninges. All the 3 meninges cover the optic nerve, and there is a potential space between the pia mater and the arachnoid mater, the subarachnoid space, where the subarachnoid fluid is there. CSF is there, and the space can be seen to be dilated when there is a papilloedema. The length of the eyeball. The length of the eyeball, as we had discussed in the one of the previous questions, the length of the eyeball in adults is 24 mm. How to measure this length? This length is measured by a special instrument called the E-scan. By a special instrument called the E-scan, which measures the interior posterior length, and this E-scan has waves at the refracting surfaces, where that is the cornea. The first wave is the cornea, the interior lens surface, the posterior lens surface, and then the retina and the scleral waves. And this last waves, small waves, are the orbital tissues. This investigation is known as the E-scan to measure the interior posterior diameter of the eye, and this investigation uses the infrared technology to measure the velocity by which we can gauge the distance. What is the next question? The next question was the corneal endothelium is embryologically derived from. We know that the corneal endothelium is embryologically derived from the neural crest cells from this table we had already studied, and this corneal stroma, you will remember from the class of the embryology that this comes in the waves. In the first wave of the neural crest cells, the endothelium is formed. The endothelium is formed, which further can give rise to the desmics. And in the second wave of the neural crest cells, the stroma is formed, which also gives the Bowman's membrane. And the epithelium of the cornea was formed by surface ectoderm. What is Circulus iridis major? The Circulus iridis major is a circle of the blood vessel which supply the iris and is present at the root of the iris, and is present at the Circulus iridis minor is present near the pupil of the iris, and the Circulus iridis major is found at the root of the iris, which is formed from the interior ciliary arteries. What is capsule of the crystalline lens is thinnest at? Capsule of the crystalline lens is thinnest at. You can see from this diagram, this is the interior pole of the lens, this is the posterior pole of the lens. It is thinnest at the posterior pole, where it is 4 micrometer only, and hence this structure we have to be very careful while doing the cataract surgery, so that the PC ring, that is the posterior capsule ring, doesn't occur and the lens doesn't go back into the vitreous. And where, if someone asks where it is thickest at, it is not thickest at the interior pole. It is just 14 micrometer. It is not thickest at the equator. So where it is thickest at, it is about posterior to the equator. It is thickest posterior to the equator. And what is the thickest measure? It is about 23 micrometers. So the capsule at the posterior pole is just 4 micrometer, 3 to 4 micrometer, which is the thinnest. And at the interior pole it is 14 micrometer, and it is thickest and just posterior to the equator, that is 23 micrometer. The next question was the average distance of the fovea from the temporal margin of the optic disc is. It is 2 disc diameter as it's seen. This is 1 disc diameter, and the average distance of the fovea, this structure fovea, from the temporal margin, this is the temporal margin of the disc, is 2 disc diameter. You can clearly visualize from this diagram, and this is the 1 disc diameter is equal to 1.5 mm, and you can correlate these two figures. One disc diameter is about 1.5 to 1.75 mm, and the distance of the fovea from the center of the optic disc is about 4.9 mm. So we can easily confirm 4.9 minus about 1 mm is 3.9 mm, so about 2 mm distance is there. Okay, so 3.9 mm, so about 4 mm distance is there between the two. So about 4 mm, it gives a 2 disc diameter distance between the temporal margin of the optic disc up to the fovea. Okay, the next question was longest and thinnest extraocular muscle is. Longest extraocular muscle is superior oblique. Okay, although the belly of the superior oblique and the superior rectus has the same length, that is 40 centimeter, but the tendon of the superior oblique is so long, that is about 20 mm. So the longest muscle will be considered as a superior oblique. Also, because of the long tendon, it is a thin tendon. It is also considered as the thinnest muscle because of the length. So the surface area will be very much increased, hence it is considered as the thinnest muscle. So we all know about the superior oblique. We have to remember all these things. The insertions of the superior oblique, the physiological origin of the superior oblique is at the trochlea, which is present at the medial orbital wall and the roof. Okay. The next question was conjunctival epithelium is. Here you may be confused as it is written pseudostratified. It is not pseudostratified. It is actually stratified. It is stratified columnar. Stratified columnar, we can't label it as stratified columnar because as we had studied in the structure, because the superficial is cylindrical and the deep is cubical in the tarsal part, and in the fornix also the superficial is cylindrical and the deep is cuboidal. So we can't label this as just columnar because both the cubical and cuboidal cells were seen. But at the limbal, it is as cylindrical is basal squamous. So the marginal and the limbal are stratified squamous epithelium. Okay, the marginal and the limbal conjunctiva are stratified squamous epithelium. But the tarsal and the fornix, though not stratified columnar, though not truly stratified columnar, but still are stratified, and we can easily label it as non-squamous. Okay, we can easily label it as non-squamous and not we should not label it as purely columnar, but we can label it as non-squamous epithelium. So because the tarsal and the fornix and the bulbar conjunctiva form the major part of the conjunctiva, hence we will choose the option stratified non-squamous epithelium and not stratified squamous epithelium if both of the options are present. If both the options, that is stratified non-squamous epithelium and stratified squamous epithelium, are present, we have to choose stratified non-squamous epithelium because the tarsal conjunctiva and the fornix and the bulbar conjunctiva form the major part of the conjunctiva. Transitional conjunctiva is transitional epithelium is not found here. You may remember it is found in the urothelium of the bladder and not in the eye. Okay. What was the last question of your test? The last question of your test was layer of the cornea with no regenerating capacity. Epithelium regenerates from the limbal stem cells. You remember that. Endothelium can regenerate from the, and it also helps in regenerating the desmids. Endothelium can regenerate, but it regenerates very slowly. Hence, we are aware of the endothelium so that there is no endothelial loss in the cataract surgery. Endothelium is very metabolically active layer. It is a very metabolic active layer. The desmids is the toughest layer. The substantia propria part of stroma is the thickest layer, and of the stroma, it is the second layer. That is the Bowman's layer. It is the second layer of the cornea. It is the thickest stroma. It is the part of the stroma which is the thickest. It is made up of dense fibrous sheet of the collagen fibers. It is a transition layer between the epithelium and the stroma, but the best thing to remember about the Bowman's is that it does not regenerate. The Bowman's does not regenerate. The substantia propria is the thickest layer. The desmids membrane, it is the toughest layer, and the endothelium is the most metabolically active layer, though, and its regeneration occurs rapidly after the injury. Regeneration occurs rapidly after the injury of the endothelium, and it contains active pump mechanism which maintains the transparency of the cornea. So this completes your test, the 20 questions which were of 40 marks, and for every 1 minute delay in submission, 1 mark would be deducted. But I hope this test, you have given this test with full vigor, and we will be conducting these tests, and these may be needed for your internal assessment. And as exams are nearing, I will request the students to please focus on your studies, to please devote your time to all the subjects, especially the third year subjects which we are studying, that is ophthalmology, ENT and SPM. Please devote your time. All the best for your exams, and we will be meeting you again in the next test. So all the best. Thank you.